So we are going to continue our short review, going through the muscles of the upper limb and the lower limb. The upper limb and the shoulder, we already covered one muscle, which was the trapezius, but then we have also the deltoid, which attaches the scapula to and the clavicle to the humerus. So you see the configuration of the deltoid, so the lateral muscle on your shoulder, and the way if you imagine it contracting, what would it do? And so the deltoid is a muscle that participates in the abduction, so pulls the arm out, and clinically this is important because it does participate in the abduction beyond the initial 15 degrees that are accomplished by the supraspinatus muscle. Deep to the trapezius, you have the rhomboids minor and the major and the levator scapula, which we already talked about. And then in the posterior scapula, so it's very important to understand where you are. So if you are struggling where I am, you're seeing the patient or the person from behind. So you see the spine of the scapula, and you see a subscapular and a a supraspinous area and an infraspinous. So you have a supraspinatus, infraspinatus, and two muscles that are called the teres major and the teres minor. These are muscles. They are sitting in the back, and you can consider the triceps, the long head of the triceps, also part of the complex. The supraspinatus, the infraspinatus, and the teres minor are three muscles that are collectively muscles of the rotator cuff that stabilize the articulation of the shoulder, or the glenohumeral articulation to be more specific. The fourth element of the rotator cuff is the subscapularis. So supraspinatus, you see, just by looking at the angle, you see that it does participate in abduction. Infraspinatus, just by looking at the angle, you see that it will try to pull the arm out. And so the supraspinatus initiates abduction, whereas the infraspinatus rotates the arm laterally. The teres major comes from the tip of the shoulder blade, the scapula, whereas the teres minor is more to the side. So the minor lateral rotates the humerus and is, don't forget, a component of the rotator cuff, whereas the major is a medial rotator and extension of the humerus. The subscapularis is anterior and allows attached to the humerus and stabilizes also the glenohumeral joint because is part of the rotator cuff, but is important for the medial rotation of the arm. So this is a very important slide once you pass the identification, because you're going to get so many words and so many different functions that may be very difficult for you to navigate that. So again, start with abduction. For the abduction, you have the supraspinatus, the first 15 degrees, and then the deltoid, you abduct. Then adductors, you have the teres major, and then you have medial rotation. The major is a medial rotator, and the subscapularis is considered to be the primary medial rotator. Normally, medial rotation goes with adduction, but you can't always get that type of association. So here, just again, once you put everything together, don't forget which are the rotator cuffs and the main functions of the muscles. In the arm, you have the anterior and posterior components. The anterior component has three muscles: the coracobrachialis, the brachialis, and the biceps brachii. Coracobrachialis comes from the coracoid process and goes all the way to the medial aspect of the humerus. And so because it crosses this picture doesn't show much, so we have to kind of infer. So the coracobrachialis goes to the medial shaft, so it goes from above the shoulder to the shaft of the humerus. Is going to act mostly on the shoulder, so it flexes the arm at the shoulder level. The brachialis comes from the mid portion of the humerus and will cross the elbow, so it's a muscle that acts on the elbow, so it's a flexor of the forearm at the elbow. These flexion and extensions, they do pay off understanding them, because otherwise it's just like you may get very complicated with that. So a muscle needs to cross the joint to be able to act on that joint. And so flexion and extension don't mean anything if you don't say what part is flexing and extending and in relation to what joint. So the arm flexes in relation to the shoulder. The forearm flexes and extends in relation to the elbow. The biceps brachii has two heads, as a short head and a long head. A short head comes from the coracoid process, together the coracobrachialis, whereas the long head, it comes from the supraglenoid tubercle and enters this intertubercle sulcus. Both of them cross the elbow and they're going to act on the radial tuberosity of forearm. So this muscle is a very complex muscle. So it's a muscle, there's a flexor of the arm at the level of the, flexor of the forearm at the level of the elbow, but also a supinator of the forearm. So you oftentimes you may see, for those of you who like to work out and you're used to workout exercises, you see that the way to do a bicep curl, sometimes you will see that people may start with a position of the hand and then they supinate, so they pronate and then supinate the forearm and then bring the forearm in or up. So that is making use of the two main functions, the supinator and the flexor. Okay, so you have these three muscles. Here actually is a better view of the coracobrachialis. And again, keep this in mind. To summarize, you have three muscles. Two muscles that cross or attach below the elbow, so they will act on the forearm, and one muscle that is acting on the shoulder, so acting on the arm. So the coracobrachialis is a flexor and adductor of the arm at the level of the shoulder, whereas the biceps and the brachialis are flexors of the forearm at the elbow. The brachialis is considered to be the strongest, and the biceps brachii is also a supinator. The posterior component are the extensor component, in which you have the triceps brachii. The triceps has three heads, a long head, a medial head, and a lateral head. They all will pass the elbow and will attach at the level of the olecranon of the ulna. So these are important extensors of the forearm at the level of the elbow. So they are the main extensors of the forearm. Don't forget the long head of the triceps is also important for stabilizing the shoulder. So again, crossing the elbow joint, you have, we talked about the flexors and the extensors. So muscles that flexors of the forearm, the biceps, the brachialis, and the brachioradialis. And then there are the triceps and then cuneus, which are muscles we are going to talk about. So we'll talk also about the brachioradialis in a second. The forearm is a flexor, the anterior is a flexor, and the posterior is the flexor. These are considered to be the most demanding in terms of memory, but the reality is that they are not that very complicated, because they make use of, the names are actually very intuitive, both if you use all the right cues to know the function as also the position. So these muscles, the majority of them, they're acting on the hand and the wrist. So they are contracting the forearm muscles to act over the hand or the wrist. The superficial layer, so again, this is going to be your best friend here, is always the anatomical position. So know what is anterior and what is posterior, know what is lateral and is medial. For these pictures, if you're seeing the olecranon, you're seeing a posterior side. If you don't see the olecranon and you see, for example, a good view of the condyle, you have a view that is anterior. Medial and lateral, don't forget, little finger is medial, and the big finger, so the helix, is going to be the lateral part. Radial follows that, and ulna follows the little finger. So the words say it all. So you have two flexor carpi on each side. So flexor of the carpus. The ulnaris all the way in the medial side, and the radialis on the radial side. Pay attention to the radialis. So you have to see if it goes on the side, and again is going to attach to the carpus. So all these three come from the medial epicondyle. So all these three muscles come, four muscles, I'm sorry, come from the medial epicondyle. So very extreme, you have the flexor carpi ulnaris, then you have the palmaris longus, which goes to the palmar aponeurosis, the flexor carpi radialis, and the pronator teres, which is a pronator. It doesn't act on the wrist. So the flexor carpi ulnaris is a flexor of the wrist and an adductor. So don't forget, adductor, because it brings the hand, the wrist, to the medial side. By bringing the rest, the wrist to the medial side is considered an adductor of the wrist. Palmari longus acts on the palmar aponeurosis. And the flexor carpi radialis does the opposite to the ulnaris. So it's on the lateral side. It's going to be flexing the wrist, but abducting the wrist, putting the wrist out to the outer part, to the side of the big finger, your thumb. Pronator teres is a pronator, so it comes from the medial epicondyle, but pronates the arm. Okay, so very simple. See, as we move forward, so there's a lot of words in the slides, but in the short review, the words are supposed to just give you, in the first read, the first study, to help you understand. But then once you understand this, you don't need to know all those details. You just need to focus on the major aspects. If you cut this, you get to see the flexor digitorum superficialis, which is a muscle that is in an intermediate layer. So you cannot see the other four muscles; they were cut, and you see a big muscle that comes both from the radius, but also from the humerus. So there's the ulnar head and the radial head, and they go all the way to the fingers, to the 4 digits. And so, because they pass, this is a good exercise for anatomy, they pass the wrist, and their last target is going to be the fingers. And so they will basically be responsible for acting on the wrist, but also the metacarpophalangeal and the proximal interphalangeal joint. So they will attach on the middle phalanges. So by attaching the middle phalanges, they will act on all the joints they'll cross: the wrist, the metacarpophalangeals, and the first interphalangeals or proximal interphalangeals. Okay, so here you have the anterior component. See if you can review the most superficial side, and if there is anything. Again, the anterior component, we normally focus on the medial epicondyle, so medial, little finger, ulnar, and you focus on these muscles, then you cut these muscles and you see the flexor digitorum superficialis. In a deeper layer, so you have to cut everything, you see the flexor digitorum profundus, the flexor pollicis longus, and the pronatus quadratus. So flexor digitorum profundus, it's underneath, it goes to the 4 digits. The flexor pollicis longus goes to the thumb, and the pronatus quadratus is the pronatus. It doesn't pass, it connects only the ulna with the radius. The muscles of the flexor digitorum profundum will then connect with the lumbrical muscles, which are these tiny muscles that are important for intrinsic movements of the hand. Flexor pollicis longus, flex the thumb, pronatus quadratus, pronates. So the flexor digitorum profundus flexes everything that crosses, including the wrist, but the distal interphalangeal joint. Flexor pollicis longus flex the thumb, and pronatus quadratus pronates. So this would be a good one for us to review. In the posterior, you have the extensors, again, acting on the wrists, joint, the fingers and the thumb, and also supinating. The brachioradialis, you could consider them here or not. The brachioradialis is a muscle that is acting on the elbow still, but all these muscles come from the lateral epicondyle side. So posterior lateral epicondyle side, and they are extensors. So the brachioradialis is, I have it here, you can have it anywhere else. So, but this is a flexor of the elbow. Extensor carpi radialis, it's the same is the same similarity between the flexors. So extensor of the carpus, so the wrist, on the radial side or on the medial side. So the longus originates from the distal part of the supraepicondyle ridge and the lateral epicondyle ridge, and it will go all the way to be able to, as you see here, they go all the way, and it will be an extensor of the carpi and also an abductor. There is a brevis, which extends and abducts the wrist, and the digitorum, which goes to the 4 digits, and the minimi, so the minimi goes to, so the minimi, that the little finger gets 2 tendons, because there's one from the extensor digitorum and another one from the extensor digitorum minimi. And the carpi ulnaris, don't forget that adducts and extends. The uncuneus is this tiny little muscle that abducts the ulna. Okay, so you have here, the names are telling you everything. Of course, from a purpose of memorization, visualization, you would have to focus on the tendons or memorize them from medial to lateral, or in this case, lateral to medial. Once you cut the posterior layer, the superficial, you get the supinator, the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, and the extensor indicis. These muscles you have to have an indication that you cut the other ones, and they're easier to see, but they are again based, they're better seen from the perspective of the tendons. So you have here a supinator, you have the abductor pollicis longus, an extensor pollicis brevis, an extensor pollicis longus, and extensor indexes. So the thumb has these three tendons that are coming from this deeper layer. The names are very typical, so abductor pollicis longus, extensor pollicis brevis extends the thumb, and now the longus extends the thumb as well, and the indices extends the indicator, the index. Okay, so there are all these tendons. They are relatively complicated when we look at the anatomical, the cadaver, for example. But actually, they may be very interesting for you. So if you for example, make a fist, you will see that you see the flexor carpi ulnaris here, the palmaris longus, and the flexor carpi radialis. On the dorsal side, you have also the possibility of seeing these extensor carpi radialis brevis and longus, and the extensor pollicis brevis. The snuff box, the anatomical snuff box, is something important. I believe I have something, yes, there's a slide there about the anatomical snuff box. So the hand, don't forget that the carpal tunnel is on the flexor side, on the anterior side. It's like a tape, keeps all the tendons there. So the flexor digitorum profundus, the flexor digitorum superficialis, the four tendons, and the flexor pollicis longus. Also the median nerve that you will learn later on. Everything needs to be attached to the fingers, and they are attached by fibrous digital sheaths. And on the back side, so on the dorsum, you have the extensor retinaculum. The palmar aponeurosis, which is this deep fascia that covers the palm, and the extensor hoods, which are attaching the extensor tendons to the fingers. The anatomical snuff box is this space that you have between these three deep tendons. So you have the abductor pollicis longus and the extensor pollicis brevis and the extensor pollicis longus. It's very important. This snuff box anatomically is important because it's we have a radial artery there passing there and can be palpated. The muscles of the hand are not muscles that we need to worry about because it's very difficult to isolate them, but they have some facts that we can know, that we should know about, that are helpful. So we have these muscles are contributing to a certain precision, so they're intrinsic muscles. And you have the palmaris brevis muscles, wrinkles the hypothenar, so this is the hypothenar, this is the thenar eminence. The adductor pollicis, the muscle that brings the thumb in. And then the dorsal interossi and the palmar interossi. This is an interesting kind of fact that, you know, it's easy built into a question, so it's important that you understand. So the abduction of the fingers is considered in relation to the middle finger. So if you bring the fingers close, you adduct. If you're spreading the fingers, you abduct. The dorsal, so the back muscles, are abductors, whereas the palmar interossi are adductors. The thenar are the muscles that make the bulk of the thenar eminence, so they're muscles that act on the pollices. There's an opponens, the flexor, and the abductor of the pollicis brevis. In the hypothenar, you have the medial act on the digitus, on the little finger, which is the digitus minimi. So they are the opponents, the abductor, and the flexor. Lumbrical muscles are muscles, again, they originate from the tendons of the flexor digitorum profundus, and they will complement, they assist the movements. Okay, so we are done with this part. So now we are moving to the lower limb. The gluteal area has a relatively superficial muscles that is identifiable as a gluteal muscles, larger, and then deeper muscles, which we talked about, the piriformis, the obturator internus already, but there are other muscles. So the deep group of muscles, the piriformis, the obturator internus, the gemellus superior, and the inferior, and the quadratus femoris. So if you look at this picture where you still have a gluteus, so you cut the maximus, you cut the medius, you still have the minimus. The first muscle here is the piriformis. The piriformis is a muscle that we talked about the connection with the great sciatica foramen. So a lot of people may have a lot of tight muscle compressing the sciatic nerve here. From the anatomy, you see, in terms of the function, it comes medial to the greater trochanter. So if you imagine contracting it, it will pull the thigh up and out. So it is an abductor of the thigh and also an external rotator. The internus covers the obturator foramen, and that one also does the same functions because it has the same trajectory. The gemellus superior and inferior, so you have the gemellus, so the superior and the inferior, and these muscles they are also coming from, sorry, skip the slide. They act with the obturator internus to laterally rotate and abduct the femur. The quadratus femoris, this one is a muscle that is a little bit more inferior. It comes from the ischium, it goes to the intertrochanteric crests, so you're seeing this from the back, and is also a lateral rotator. So all these deeper muscles are rotators, lateral rotators, and assisting also with abduction, except for the quadratus femoris. A more superficial, you have the gluteus minimus, medius, and maximus. So the minimus, you see it here, it will come from the ilium to the greater trochanter. The minimus and the medius, they act together. So the medius is superficial to the minimus, and they'll go to the greater trochanter. And so the minimus and the minimus, they are responsible for abducting the hip as we lift the other foot. So if, for example, you lift one foot off the floor, the tendency could be to for the thigh to go in and the other opposite thigh to go in, but you're basically forced to contract the medius and the minimus to keep the thigh out, and so you're contracting the gluteus minimus and the medius prevents the excessive pelvic tilt. So they are abductors of the lower limb. The maximus is a big muscle that is on the outer part, is the most recognizable of the gluteus, and it extends the flexed thigh at the hip joint. So if your thigh was flexed, you to straighten it up, to extend it, you are using mostly the maximus. So this muscle comes from comes from all the pelvic bone, but it will attach to the onto the femur, and it will be also part of this called the iliotibial tract. So it stabilizes those joints. Okay, so the minimus and the medius act together. They are abductors of the femur, whereas the maximus is an extensor of the femur. So if you can see different ways of exploring, but again, this is also a muscle that people may attempt to work out for different reasons. So you have it. It's relatively superficial, and so it's very important. You can use it to feel the actions of the maximus. So if you are flexing your thigh, and then if you try to extend the thigh, you are contracting your gluteus maximus. The tensor fasciae lati stabilizes the knee because it will act on the iliotibial tract, which is this tensor fascia lati. So let's put it together, all these muscles. So we have extensors, rotators, and abductors. So the abductors is the medius and the minimus. The extensors is the maximus, and the rotators, all lateral rotators, you have the piriformis, the obturator, internus, and the gemellus, and the quadratus femoris. Like we discussed in the case of the arm and the forearm, every time a muscle crosses the joint, it has the capacity to act on that joint. So the maximus and the tensor fasciae latae are also extensors of the knee. In the thigh, we're going to have muscles of the anterior and the posterior compartment, but we also have a medial compartment of the thigh. The anterior compartment is extensor, so if you are just based on mnemonics, you'll see that this is the opposite to the upper limb, but you have to think about extensors of what? So extensors of the knee, if they act on the knee. So you have the sartorius, you have the quadriceps, and you have the quadriceps, which are basically four muscles: the rectus femoris, the vastus, lateralis, medialis, and intermedius. So the sartorius is an interesting muscle, is superficial, is in the anterior compartment, is a long strap-like muscle. So it goes all the way from the anterior superior iliac spine to the tibia. And so this is a muscle that assists in flexing the thigh at the hip joint and the leg at the knee joint. The quadriceps femoris has four components: the vastus, medialis, intermedius, and lateralis, and the rectus femoris. There is a certain difference, but we don't have to worry too much about it. So these are mainly extensors of the leg at the knee joint. The rectus femoris comes a little bit more from above, from the hip, so will also assist in the flexion of the thigh at the hip joint. The iliopsoas is a muscle that we already talked about. Again, comes from way above, so the vertebral column and the iliacus, and then goes to the lesser trochanter of the femur. So this is a muscle that also acts on the hip. And in this case, it is a flexor and a lateral rotator of the hip. So flexors of the hip, we have the sartorius, the iliopsoas, and the pectineus. And extensors of the knee, we have the quadriceps femoris. In the medial compartment, we have the adductors. Adductors meaning that they will bring the thigh in. And so we have the gracilis, the pectineus, and the obturator externus, as well as the adductors. We have three adductors: the magnus, the brevis, and the longus. Collectively, they adduct. Okay, the externus can also, the obturator externus is also a lateral rotator. So identifying them here, you see the gracilis. Sometimes students confuse the gracilis with the sartorius, but it's important to understand that the sartorius comes from the anterior superior iliac spine. This one comes from the pubic bone. So to review the sartorius, sorry, that you don't get confused. So you see the sartorius here. So here was cut and goes like this. This one is the gracilis. If you cut the gracilis, you find now you're seeing more to the lateral side. You have the pectineus, you have the adductor. In the adductors, you have a longus, a magnus, and the brevis. Brevis smaller, and magnus is very large with this adductor foramen. The obturator externus comes from the outer part of the obturator foramen and will be attached to the the lateral wall of the truncatary fossa. This is an external rotator. Okay, so we can see all the muscles here collectively, the lateral, the anterior, and the lateral component. So we have adductors, all of them, except for the obturator externus, which is the lateral rotator of the hip. The posterior components are where we sometimes talk about we can call the hamstrings. So we have three muscles, a biceps femoris, which has two heads, and the semitendinous and the semimembranous. It is tricky to know which one is what, and I think we all get a little bit confused because the images that sometimes we're given are not very clear, so this requires a little bit more of anatomy knowledge than just based on the images. So you have the two biceps here, which are outer, lateral, so you have the head of the biceps femoris and the short head of the biceps femoris. Medially, you have the tendinous and the membranous. The tendinous is more superficial, the membranous, the semimembranous is more is deeper. These four muscles are, or three muscles are the hamstrings. So they'll flex the leg at the knee and extend the hip, the thigh at the hip. So you see lateral, it goes to the fibula, the biceps, and the semitendinous, which is the more superficial of the medial, goes to the tibia, and the membranous, which is deeper. So don't forget that. In terms of anatomy, which you'll never see at this picture, the membranous, semimembranous is because it's half membrane, half muscle, semitendon because it's almost half muscle, half tendon. So hamstrings are essentially flexors of the knee and extend the hip. The biceps femoris can also act as a lateral rotator, whereas the semitendinous and the semimembranous are medial rotators of the knee, not the hip, the knee. So we move to the leg. We also have an anterior and posterior component. A posterior component of the leg have superficial and deep, and in terms of the function, if you try to look at them, you are plantar flex and invert the foot and flex the toes. It's a bit tricky to know what flexing the toes are, inverting the toes are, and plantar flex are, but you're talking about the posterior. So imagine the posterior, if you look at the posterior part of your leg, and you imagine contracting all these muscles, what you're doing. So you're bringing everything that the foot has almost to the floor, or if you are, or inferiorly, if you almost want to see this way. So you flex the toes, you can invert the foot, and you flex the plant of the foot. So the big muscles that you see in the back of the leg are the gastrocnemius, and then underneath you have two muscles, the plantaris and the soleus. These muscles insert in the calcaneus. The gastrocnemius as the medial and lateral head. It'll continue as a calcaneal tendon. Plantaris, a tiny little muscle, the belly, and the soleus underneath. These muscles are essential flexors of the foot. So they're acting on the foot. They are not acting on the toes. They act simply on the foot because they form the calcaneal tendon. This is a very beautiful representation. When you cut these, you're going to find the popliteus in muscles that now cross into the toes. You have the flexor hallucis longus, flexor digitorum longus, and the tibialis posterior. So the popliteus doesn't reach much more, so it's a muscle that acts on the knee, whereas the other three act on the foot. So the popliteus is this muscle here. Not a very important function. And the flexor hallucis longus is a muscle that goes all the way, and it will go all the way to the big toe, the hallux. And like the name says, is a flexor of the hallux longus. These pictures, I like them, but maybe trick a little bit. It's a very an image that is more in cadavers, so it may not make sense because it's almost the foot is super extended, but you see that what is representation here. So there's a muscle comes from the fibula and goes all the way to the tip of the hallux. The digitorum longus is a muscle that originates from the medial side of the posterior compartment and will go all the way to the distal phalanges of the digits 2 through 5. The tibialis posterior is a muscle that comes from the tibia, but now if you look at it, it will go onto the medial side, onto the navicular and the cuneiform muscle. So if you imagine getting this muscle together, contracting this muscle, it will be a very important muscle of inversion, so bringing the plants of the foot in. So deep group plantar flexors of the foot. Tibialis posterior is an important inverter. Flexor hallucis longus, it is important for flexing the big toe, and the digitorum flexing the other digits. They all have, as they cross the different joints, they are important for their stabilization and contraction. Popliteus in the popliteal fossa. It's a muscle that basically assists with movements of the knee. Okay, this is a very simple kind of diagram, but you have to understand that, you know, in these pictures, if you don't orient yourself very well, you may even think that you're seeing the muscle, the bone from the leg from the anterior side, where you're seeing from the posterior side. In the lateral compartment, you have the fibularis longus and the fibularis vertis. Fibularis, they come from the lateral, they go all the way to the outer part of the foot, and therefore they are everters. The longus crosses the foot, and so it crosses under the foot to attach bones on the medial side of the foot, and therefore it also contributes to plantar flexion. You see that it goes to the medial side this way. So these are fibularis, lateral, goes to medial. Don't forget, fibula is lateral. So primarily everters, but don't forget the longus is also a plantar flexion. Again, localize where you are using the lateral side, so fibula is lateral. The anterior compartment, you have the tibialis. So you have the tibialis anterior, you have the extensor hallucis longus, extensor digitorum longus, and the fibularis tertius. So the way they are, if you imagine contracting them, you are pulling the foot up, which is dorsiflexing the foot at the ankle joint, and contracting the toes in a way that is extending. I'm sorry, I'm being a little bit sloppy. We don't contract the toes. You contract the muscles, and then we extend the toes, so the toes go up. And there's also because it comes from the medial side, it will also help with the inversion of the foot. So the tibialis is anterior, dorsiflexes the foot and inverts the foot, so it will attach to, so you follow this muscle, you see the attachment on the cuneiforms and metatarsal. The hallucis longus goes all the way, so you talk about the hallucis longus, you see I can even follow just a tendon, it goes all the way on the dorsal side, and the digitorum longus will go to the other digits. The tertius is a muscle that sometimes doesn't even exist, so if it exists, it's considered part of the extensor digitorum longus. Okay, so we have the muscles by function, the tibialis anterior, extensor hallucis longus, digitorum longus, and peroneus tertius. A peroneus or fibularis is the same thing. The foot, it has a tarsal tunnel, similar to a carpal tunnel. It has an extensor retinacula, a fibular retinacula, has plantar aponeurosis, it has the fibrous sheaths, the extensor hoods, and it has intrinsic muscles too, and muscles that are less important to know, but we have the extensor digitorum brevis, the extensor hallucis brevis, and these are on the dorsal side, so the upper side. So the extensor hallucis brevis, and then you have the extensor digitorum brevis. The intrinsic muscles on the plantar side are more complicated. There are 4 layers. The first layer, again, just know they exist, the abductor hallucis and the abductor digiti minimi, and then the flexor digitorum brevis. The second layer we have the quadratus plantae and the 4 lumbrical. And the third layer we have flexor hallucis and adductor hallucis, and then you have flexor digiti minimi brevis. So all these muscles are part of the adductor hallucis. The fourth layer, we have the dorsal and plantar forci. The dorsal abduct, the plantar adduct the toes. And we're done.